I am Devasena. In this lecture, we are going to discuss about cardiac output. This topic is present in the subject Medical Electronics. Cardiac output. Cardiac output and blood pressure are two important measures of the health and function of cardiovascular system. Cardiac output, known as Q, is a measure of the amount of blood that is pumped out of the heart in 1 minute. Such devices have proved useful when the patient is immobile, that is, the patient is in intensive care and under anesthesia, but may be subject to patient movement artifacts in other situations. Cardiac output is volume of blood pumped from each ventricle per minute. Here it is a relationship between the cardiac output stroke volume and heart rate. Normally, cardiac output is equal to stroke volume into heart rate. The unit of the cardiac output is ml per minute. The unit of the stroke volume is ml per beat, and the unit of the heart rate is beats per minute. Factors affecting heart rate are as follows. First one, autonomic innervation. Second one, hormones. Third one, fitness levels. And fourth one, age. These are the factors that affects the heart rate's function. Let us see the factors affecting stroke volume. First one, heart size. Second is fitness levels, gender, contractility, duration of contraction, preload and afterload. These are the factors that affects the stroke volume. Cardiac cycle. The cardiac cycle is the performance of the human heart from the beginning of one heartbeat to the beginning of the next. Here is a representation of the cardiac cycle. It consists of two periods. One during which the heart muscle relaxes and refills with blood called diastole. The other is following a period of robust contraction and pumping of blood dubbed systole. Cardiac cycle representation is shown below. Here is a representation for the cardiac cycle. The cardiac cycle starts from atrial systole, followed by isovolumic ventricular contraction. After isovolumic ventricular contraction, we have ventricular systole. The ventricular systole is followed by ventricular diastole. As soon as the ventricular diastole completes, once again the atrial systole happens. That is, this cardiac cycle repeats. Heart rate. Heart rates increase as the intensity of activity increases. This is because the working muscles demand more energy. So the heart beats increasingly faster in order to deliver the nutrition and oxygen needed to meet these increased energy demands. Average heart rates by age. Here is a representation of average heart rates by age. Age in years. Average maximum heartbeat in beats per minute. Target heart rate range in beats per minute. At the age 40, the average maximum heartbeat is 180. Then the target range is 90 to 153. At the age of 45, the maximum heartbeat is 175. The target range is 88 to 149. At the age of 50, the maximum heart rate is 170. The target heart rate range is 85 to 145. At the age of 55, the maximum heart rate in beats is 165. The target range is 83 to 140. At the age 60, the maximum heartbeat rate is 160. The range is 80 to 136. At the age of 65, the maximum heart rate is 155. The target beat is 78 to 132. At the age of 70, the maximum heart rate is 150. The heart rate range is 75 to 128. Blood flow representation to and from the heart is shown here. In this diagram, impure blood is collected from all parts of the body. That impure blood is poured into the right atrium. From the right atrium, it is poured into the right ventricle, and through the pulmonary artery, the impure blood is carried, and in the lungs, the purification process, that is gas exchange, takes place, and the oxygen that is present in the lungs is transferred to the blood. Now the blood gets purified. The pure blood is carried by the pulmonary vein, and in the left atrium, the pure blood is poured, and from the left atrium, it is passed to the left ventricle, and from the left ventricle, it is distributed to all parts of the body. Here is another representation. The sequence, blood flow sequence, starts from right atrium, tricuspid valve, right ventricle, pulmonary valve, pulmonary arteries, pulmonary veins, left atrium, mitral valve, left ventricle, aortic valve, aorta. Stroke volume, SV, refers to the quantity of blood pumped out of the left ventricle with every heartbeat. The exact volumes are not easily measured, so they are often estimated based on what we know about the stroke volume and the factors that it affects, such as blood pressure, which we can measure. Stroke volumes for each ventricle are generally equal, both being approximately 70 ml in a healthy 70 kg man. Men on average have higher stroke volumes than women due to larger size of hearts. Here is a representation of cardiac output. In this diagram, the cardiac output is equal to heart rate into stroke volume. The factors that has to be considered for the heart rate is nerves and the hormones. Similarly, the factors that has to be considered for the stroke volume is blood volume and vascular resistance. Cardiac output at rest is equal to 5 liters per minute. The 5 liters per minute calculation is shown here. In this, the cardiac output at rest is 5 liters per minute. The heart consumes 4%, that is 200 ml of the blood. The liver consumes 27%, that is 1350 ml. Kidneys consumes 22% of the blood, that is 1100 ml. Brain consumes 14%, that is 700 ml of blood. Skin consumes 6%, that is 300 ml of the blood. Muscles consumes 20%, that is 1000 ml of the blood is consumed by the muscles, and the others consumes 7%, that is 350 ml of the blood is consumed by others. The equation for the cardiac output is heart rate into stroke volume is equal to cardiac output. To calculate cardiac output Q, we must first establish heart rate and stroke volume SV. An example at rest is shown below. Consider heart rate value is 70 beats per minute and stroke volume SV value is 70 ml. Therefore, 70 into 70, that gives 4900 ml per minute or 4.9 liters per minute. In this way, we have to calculate the cardiac output. Cardiac output is equal to heart rate into stroke volume. An increase in heart rate, stroke volume or both will increase sometimes cardiac output Q. Stroke volume on the whole does not fluctuate too much, with only relatively small increases with exercise. Heart rate on the other hand increases quite dramatically and thus is the biggest influencer of increasing sometimes cardiac output Q. Changes in the volume of blood within the cardiovascular system will also affect blood pressure BP. If a person was severely dehydrated or lost a large quantity of blood through wound, there would be less blood for the heart to pump, thereby reducing cardiac output and blood pressure BP. If the volume of blood increased, that is waste products not being removed to the kidneys due to kidney failure for example, then there would be greater quantity of blood within the system, increasing the pressure within. Cardiac output measurements. Fick method, indicator dilution method and Doppler echography method. With the help of these methods, we can measure the cardiac output. Pathological variation of cardiac output. We have pathological increase, that is hyperthyroidism and fever. And we have pathological decrease that leads to hypothyroidism, hypovolemia, hemorrhage, and myocardial infarction. Regulation of cardiac output. It means maintaining a constant cardiac output around 5 liters per minute under normal conditions and adjusting the cardiac output as per the physiological demands. It has to be regulated to have an cardiovascular efficiency. Hypoeffective heart. In this, the heart is pumping at a very slow rate and the cardiac output decreases. Factors can cause hypoeffectivity are following: increased atrial pressure, inhibition of nervous excitation, coronary artery blockage, abnormal heart rhythm, valvular heart disease, congenital heart disease, myocarditis, cardiac hypoxemia. This is the representation of hypoeffective heart. In here, insufficient blood flow to the heart muscle from narrowing a coronary artery may cause chest pain. It is indicated here. Hypereffective heart. In this, the heart is pumping at a high rate and the cardiac output increases. Two types of factors can make the heart better pump than normal. One is nervous stimulation. It involves sympathetic stimulation and parasympathetic inhibition. And the another one is hypertrophy of heart muscles. It involves the increased mass and contractile strength due to exercise and causing hypertrophy, which allows increased cardiac output. Here is the representation of the hyper-effective heart. Pathologically, high or low cardiac output. In healthy humans, the average cardiac outputs are surprisingly constant from one person to another. However, multiple clinical abnormalities can cause either high or low cardiac output. Cardiac output Fick method. It is devised in 1870, not used practically until 1950s. Easy to get representative atrial blood sample. Example, femoral artery, branchial artery. Difficult to get a representative venous blood sample. The Fick principle. The total uptake or release of a substance by the peripheral tissues is equal to the product of the blood flow to the peripheral tissues and the atrial venous concentration difference, that is gradient of the substance. Cardiac output Fick method representation is shown here. In this diagram, we are calculating the oxygen flow in the blood, that is we are calculating volume of oxygen and volume of oxygen out from the patient, that is venous oxygen concentration C suffix V is calculated and atrial oxygen concentration C suffix A is calculated. Therefore, Fick teaches us that oxygen extraction is determined by the following equation. Volume of oxygen extraction is equal to cardiac output into atrial oxygen concentration minus cardiac output into venous oxygen concentration. From this equation, we can obtain the oxygen extraction. We can rearrange that to a form of an equation which calculates cardiac output on the basis of oxygen extraction. That is, cardiac output is equal to oxygen extraction divided by atrial oxygen concentration minus venous oxygen concentration. It is indicated in this equation. So, in a normal person with a body surface area of 2 meters square and thus with a oxygen concentration of 250 ml per minute, cardiac output is equal to 250 ml divided by 200 ml minus 150 ml. That is 250 divided by 50. That is equal to 5 liter per minute. In this way, we can calculate the cardiac output with the help of Fick method. Indicator dilution method. By plotting the concentration of the indicator against time, one can obtain the area under the curve of the concentration versus time plot. Cardiac output is determined by taking the known amount of indicator and dividing it by the area under the curve. The indicator dilution method is performed by injecting a bolus of cold saline in the proximal port of the catheter. There it mixes with the blood, lowering the temperature. When blood flows past the distal thermistor port, the temperature change over time is recorded as a temperature time curve. Indicator dilution method representation is shown below. Here we have the curve also. Amount of dye added is equal to 5 mg. Average dye concentration is equal to 2 mg per liter. Therefore, the volume that diluted the dye is equal to 5 mg. That is equal to 2.5 liter. Time it took to go past is equal to 0.5 minute. That is, flow rate is equal to 2.5 liter. That is equal to 5 liter per minute. Practical considerations. Dye recirculates in the cardiovascular system. Estimate of the first transit time is facilitated by plotting log concentration. Dye must be non-toxic and not immediately absorbed. Example, indocyanine green injected into pulmonary artery. It is measured in bronchial artery. Like the Fick method, this method is invasive and discontinuous.
Thank you very much for listening this lecture. For further updates, kindly subscribe this channel. If you like this video means kindly share this video to your friends.